these policies matter, and you don't have to respond from a place of altruism or idealism, that even just from the perspective of cold, hard national interest, that alone is a reason to respond with good policies, humane policies, and to tackle these issues of conflict and refugees and immigrants into this country. There is the concept of blowback, and it's going to come. We will experience blowback from the current policies, and we have experienced that blowback in the past.
Hi, everyone, and welcome to the 5th edition of what is a novel course for us, the politics in the time of global pandemics. We're really excited to invite you, the general public, into the classroom as we examine from a social science and political science perspective what is a seminal event in the contemporary era, and that is the advent of the COVID pandemic. This week, we're really excited to have an excellent panel which will examine together the impact of COVID on the most fragile communities that we have in the globe. We are very excited to be able to do this, and we're able to come to you and bring you to us through our partnership with the Ford Hall Forum, which is now in its 112th year and the oldest free public lecture series in the United States. Tonight, we have a great panel of experts covering all of these areas, and our moderator is Dara Lind. Dara Lind is a reporter for Propublica, and she has been covering immigration policy for much of her career. Prior to coming to Propublica, she spent 5 years as co-host of Vox's podcast, The Weeds. So I'll give a shout out to The Weeds. I'm a big fan. And I'm also ready to turn over the panel to Dara. Dara, please.
Thank you so much, and thanks to everyone who has dialed in. I'm coming to you from Washington, D.C., which is suddenly an apocalyptic thunderstorm, so assuming that my power doesn't go out, this should be a great discussion. I don't want to take up too much of everyone's time because we have some tremendous expertise on our panel today. I'm joined by, in alphabetical order, unless I screw this up, Adriana Lafaille of the ACLU of Massachusetts, Doug Massey, who is a professor of sociology and public affairs at Princeton, Ragini Shah, who is a clinical professor of law at Suffolk and founded Suffolk's first immigration clinic, and Dean Maria Toyada, who is Dean of the College of Arts and Sciences and a professor of political science at Suffolk University. Dr. Massey, why don't we start with, because migration and refugee issues were, I think it's fair to say, in flux even before the current pandemic turned everything on its head. So why don't we start with, maybe the brief rundown version of what the status quo looked like before the coronavirus hit?
Well, before the coronavirus hit, there was a massive transformation of what was happening at the Mexico-US border. And what had been a massive flow of Mexican workers, mainly male workers, coming into the United States for jobs disappeared and was replaced by a much smaller inflow of Central Americans who were entering not for jobs, but for refuge and asylum. And the composition of these two flows is very different. One is working age males, some females, but all working age. Very few children, and the other one, the refugees, are women and children and families. I can show some slides to illustrate this if you have them prepared. So the first slide shows the massive drop in apprehensions of Mexicans along the border. The solid line goes from in the 90s down to about 29%, 29.5% in the year 2019, the most recent year for which we have data available. And meanwhile, immigration entry apprehensions from the Northern Triangle rocket up to 74%, almost 3/4. So this tells you that there's been a massive transformation. Then when you look at the composition of these two populations, on the next slide, you see that unaccompanied minors are very few Mexicans. Only about 18% are Mexican. The rest come from the Northern Triangle countries of Honduras, Guatemala, and Salvador. And family status is even smaller in terms of Mexicans, tiny percentage. It's overwhelmingly from Honduras, Guatemala, and El Salvador. And finally, single adults is the only category where Mexicans still predominate. But their single adults are now becoming a very small part of the flow. Move to the next slide. So here you can see, this is a monthly tabulation, month by month from October of 2016 up to August of 2019. And you see that for most of this period, the dashed line prevailed. That was single adults. And then suddenly in October and December of 2018, February of 19, April of 19, you see the massive surge in family migrants coming in family units. Single adults peak a bit, unaccompanied children peak a bit, but what really happened was a massive surge of refugees and asylum seekers coming to the southern border, not for jobs, but for refuge. And what they're trying to escape in their countries of origin are horrendous conditions that really date to the US intervention in the 1980s. So in a very real way, US policies are responsible for the conditions that these people are facing, and they're quite logically turning to the United States for refuge to escape these terrible conditions.
Can we maybe, Professor Shah, can we maybe look a little bit as well at how this looked on the ground for people after they had arrived in the US? And what kind of obstacles they've already been facing, and how that's been affected by the global pandemic?
Certainly. And so one thing I would just also say is that at the same time that this transformation is happening in terms of less people coming for economic reasons and many more people coming because they're fleeing violence, the laws in the country and the way that the administration is treating people who are coming in has also changed. And I'm of course talking about the Trump administration, and all of you may know that Donald Trump began his campaign by talking about, really the desire to keep out Mexican migrants. And so even though the reality is that Mexican migration had decreased by the time he ran, what he really did when he got into office was make it very difficult for all of these people who are fleeing from harm to actually seek status in the US. So there's something called asylum, which people can apply for if they are fleeing harm in their home countries. Now that harm has to be based on just 5 different things. And you can think of like some examples of people who are fleeing religious persecution, right? But a lot of people who are fleeing from Central America, from Honduras, Guatemala, and El Salvador are actually fleeing violence by non-governmental organizations that sort of act like a state, right? They're fleeing from gang violence, they're fleeing from family violence, and they really cannot have the protection of their state. So under asylum law as it existed before, it's not that these kinds of applications were easy, but they were possible. And the Trump administration has done everything in its power to make it more and more difficult for those folks to apply for asylum. So in the clinic that I run at Suffolk, we do some asylum cases. And what we noticed, particularly in the last few years, is that it has become very difficult to get an approval for a case that we would have won fairly easily in, let's say, 2013 or 2014.
Before we get into, I think, a little bit more specific about the effects that the coronavirus has had, it might be worth talking a little bit about, the another strain of U.S. policy going into this in terms of just straight up preventing people from being able to be in the U.S. at all. Ms. Lafaille, Professor Lafaille, however, whatever the honorific is there, could you maybe talk some about the work that you've done with your clients who are ostensibly U.S. asylum seekers but are in practice outside the U.S.?
Yeah, so this has to do with, what this surge of refugees that Doug talked about faced once they got here. And what they faced is really an administration that not only did not see them as human beings at all, but was just determined to do anything possible to stop this migration. And ideas that were batted around were, electrifying the border wall, putting spikes on it that would pierce human flesh, having soldiers shoot migrants in the legs. And unfortunately, while those things didn't come to fruition, the things that have come to fruition have been no less horrific. The effect that the administration has been seeking has been pursued through the complete destruction of our asylum system and the brutal punishment of people who come here to seek our help. We saw that with the family separation crisis, and particularly in 2018, with young children being taken from their parents. And another form that we have seen that in is this very misnamed program called the Migrant Protection Protocols, which I'll refer to as MPP. Some people have heard of it as the Remain in Mexico program. So the idea behind MPP is that when asylum seekers come to the southern border, they will be processed, and the administration will not use some of the expedited tools that it has, that Congress has provided to screen for the strength of people's asylum claims. Instead, it puts people into removal proceedings and then sends them back to Mexico for months to await these proceedings. So I thought I might just talk about this a little bit in the context of one of the clients that we're so fortunate to be able to work with over at the ACLU. So this is our client, Floridalma, and Floridalma is an indigenous Guatemalan woman who suffered a lifetime of persecution, including at the hands of people that she had to work for as a young child. As she got older, the abuse took many different forms over the course of her life. And finally, when her daughter started to be a target as well, she left. She fled Guatemala in June 2019. And she came up to the southern border around July 2019. And that is where she intersected with the expansion of the migrant protection protocols. In July 2019, the MPP, which had started months earlier in one part of the Mexican border, were expanded all the way across the Mexican border to a Mexican state called Tamaulipas. Now, Tamaulipas is a level 4 danger area. The United States Department of State tells people, do not travel there. This area is run by cartels, and the cartels hunt these migrants down. It's literally unsafe for them to be outside in certain places in broad daylight because cartels will hunt them down and pursue them for ransoms and things like that. Floridalma came to the southern border in July 2019. She was devastated to learn that she would be returned to Mexico. Now, even she imagined that surely there would be a shelter, a detention facility, a place where they were sending migrants to in Mexico. But no, she was simply, told to walk over a bridge, and she was cast out onto the street. And there was a little park at the other side of the bridge. And, that was where she and her daughter slept for a month. Now, this is a 4-year-old child at the time. After about a month, there started to be more people there, more and more people being sent back from Mexico. Somebody gave them a tent. An encampment started to form. And for the next 9 months, Floridalma and her daughter lived in that tent. And every few months, they would come up to the border to attend an immigration court hearing. And that is sort of the basic way that these migrant protection protocols work.
Dean Toyada, I don't want to, oh yes, please, go.
No, sorry, I just wanted to add just one thing. I think Adriana has really very forcefully laid out the situation with the migrant protection protocols But one of the things, Dara, just going back to your earlier question about change that's occurred because of the pandemic, unfortunately, the administration has used the pandemic as a way of really implementing their political agenda on immigration. And one of the things that they've done is through the Centers for Disease Control, which is supposed to be the entity that's helping us all face the pandemic in the country, right? But instead, they've used the Centers for Disease Control to issue a proclamation that stops people from applying for asylum at the border. So in addition to all these folks who are sent back to Mexico, that was before the CDC issued its proclamation this summer. Now, nobody who arrives at the southern border can apply for asylum. They are sent back with no hearing, nothing. And so, this is, many people would say, a violation of international law. Our obligations to protect people fleeing harm is a part of international law. We actually came a little bit late to the table in protecting people back in 1980. But since then, we've had a fairly, not always consistent, but somewhat a commitment, at least, to protecting people. And now there's sort of like, because of the pandemic, that's just turned off completely. And one other thing I'll say is that it's not just limited to asylum seekers. We've also basically stopped lawful immigration to the United States right now in this time of pandemic. The consulates in other countries where people have to go to be interviewed have closed. So we have clients who are trying to apply for their parents, for their spouses. None of that is happening right now. In addition, the administration just basically put a stop to anybody applying for a work visa from abroad. So they've really been able, unfortunately, to use the pandemic to get to basically build an invisible wall. They haven't built the physical wall, but they may as well have, because none of the people who would otherwise be able to come in and apply for status have been able to do that.
And just to pick up on where that story leaves us with MPP specifically, since March of this year, the administration has canceled all the court hearings associated with the MPP. So the administration has put 60,000 people into the MPP, sent them into Mexico. They're living, some of them in this migrant camp that you saw Flor de Alma in, and some of, many of them just renting rooms in conditions that are, very precarious. And they're just stuck in this limbo. On Friday, the administration issued an order that it will not reopen MPP court until these extremely difficult health metrics are met in several areas. All the US border states and all the 3 US border states and all 6 Mexican border states have to reach certain parameters, as well as certain Department of State and CDC parameters have to be satisfied. So it's very clear that MPP hearings are not going to resume for a very, very long time. And we've just left tens of thousands of people in Mexico who are desperate and came here seeking our help and are just have absolutely no recourse right now.
Dean Toyada, I'm wondering, one of the things that I think everything that our panelists have said so far has demonstrated is that it's really impossible to think about migration policy as something that is just kind of imposed by one country because of the after effects on both, sending countries from which people might be fleeing and the places where they're, the kind of third countries like Mexico that are now responsible for migrant populations as the result of other governments taking action. So, how do the global trends on displaced people and migration jibe with what we've seen in the US context in terms of a crackdown before the pandemic being now accelerated and justified by the pandemic itself?
In many ways, what Doug and Adriana and Ragini have been describing jives very closely with what we've been seeing in the global environment for the last decade. So starting in about 2010, we've seen a huge explosion in the number of refugees. At this point, there are about 26 million refugees cross-border refugees who are fleeing a number of conflicts. And this has something to do with, with regime change. It has a lot to do with sometimes environmental conflict. It has to do with inter-ethnic conflict. In addition to the 26 million who are displaced cross-border, there are close to another 50 million internally displaced persons. So this is a problem that has exploded in the last decade. And if you look at just what some of the top sending countries are, you can track them very closely to the conflicts that they are experiencing in those countries. So obviously, Syria is a large producer of cross-border refugees. Venezuela, another one that is creating refugees because of regime change and economic displacement. Afghanistan, South Sudan, Myanmar. If you think about the fact that 1 million Rohingya, the people in the Rohingya community, and it's an ethnic group in Burma, are in Bangladesh. You can see the way in which the nature of conflict has changed over the last couple of decades, and how the impact of this is the creation of massive refugee problems. The other thing that tracks really closely is what happens to these folks. In many of these instances, they are gathering at either camps that are created and sponsored by the receiving state, or through spontaneously, emerging camps like the one that Adriana was describing. These camps can range from 10,000 people to 100,000 people. It's not unusual to see camps that are that large. That's the size of a city, a small city. And these camps have, and we'll get to this later, I'm sure, when we discuss what the impact of the pandemic is. But these camps are often unsanitary, dangerous places. There's a lot of organized crime, a lot of other kinds of violent crimes taking place within these camps. There's extortion happening, there are rapes, there are kidnappings, there are all kinds of things that are happening in the camps. They are not safe places for these folks. And what might also be surprising to a lot of people is that the average stay of a refugee in one of these camps globally is about 17 years. I mean, if you can imagine fleeing from a situation of conflict, feeling like you have to flee from conflict, and then being put in a camp, stuck in a camp for 17 years before there's any kind of resolution or any hope of getting out of that camp. That conflict has to be really dangerous, and it has to really provide an incentive for somebody to flee into that situation.
So, yeah, let's talk a little bit more. I mean, we've gotten into a little bit of the responses that governments have been taking to the pandemic in terms of, changing their policies toward migration. But let's talk a little bit about the impact of the pandemic on migrants themselves. Professor Shah, can you maybe start with talking about what you're seeing from your clients who are, in the United States, but already marginalized before this hit, and then, being affected by the pandemic sweeping through?
Definitely, and thank you for that question. So I'm gonna actually focus on, we have a number of clients who've been affected, as you can imagine, but I'm gonna focus on the stories of 3 of the clients who I think kind of represent the range of things that's going on. And so one of the clients that we represent is what's called an unaccompanied minor, which you saw earlier on one of Doug's slides. That basically references a person who's under the age of 18 and came across the US border by themselves without adult family members. And this young man came into the US, and we were able to help him get what's called special immigrant juvenile status. But he's basically with that status, but waiting for his ability to apply for a green card. He has to sort of wait in line to do that. And so essentially he's somebody who is very much at the margins of US society. He's young. He's from El Salvador. He is very low income. He's somebody who's had to work in construction because he's still technically undocumented, even though he has a status. He doesn't have authorization to work. And he lost his job as a result of the pandemic, as many, many people did. But unlike a lot of people who could then access state benefits, our client, because he's undocumented, is not eligible for unemployment. So he was really left in this horrible situation where he was living with roommates, and because there's an eviction moratorium in Massachusetts, he didn't have to worry as much about rent, but he couldn't pay for food. And so we were, kind of rapidly trying to figure out what are resources that we can point him to, but also in the meantime, we just sort of sent him a care package of food because he literally hadn't eaten for, I think it was maybe a few days before he finally reached out to us. On the other side of the spectrum is we have a client who was approved for asylum recently, and she's a Black woman from an African country, and she has been working for many years, actually, in a number of nursing homes. And some of you may have started to hear these stories, right, about the number of nursing home employees who started to test positive for COVID, and also the fact that that's where it was spreading. And one of the reasons for that is because people who work in nursing homes don't make enough money to just work one job. They usually work 2-3 jobs. And our client is definitely an example of that. She works 3 different jobs, which she continued to go to after the pandemic hit Massachusetts. And she did contract the virus herself. Unfortunately, brought it home. She lives in a very small apartment with 4 of her family members, including her 84-year-old mother, who also contracted the virus. And thankfully, everybody recovered, but it was a very harrowing sort of time for everybody. And the access that this family has to healthcare is more limited, even though our client works in the healthcare industry. I mean, our client's mother couldn't even get an appointment at the doctor's office. And so I think, probably a lot of people in the audience know many, many stories like this, right? And the last one I'll just quickly say is that we have several clients, and one in particular who's been waiting for an interview for her green card for many months. And because of the pandemic, there are no interviews happening. Just like I said, there's nothing happening at consulates abroad. There's no interviews happening in the US. So it's leaving a lot of people in this state of limbo. And we have one young client who was hoping to be able to get interviewed and approved for her green card so that she could access financial aid for college. She's sort of putting off college somewhat indefinitely until she can get the kind of status that will allow her to access financial aid. So unfortunately, I also will say that there's been stories of people coming together and really providing assistance for each other, but it's very unfortunate that it's been so necessary because of the absence of state services and infrastructure that's available for folks.
This is in addition to those folks who are kind of in the community and don't necessarily have access to the safety net structures that their peers do. There's also, of course, the issue of immigrants who are currently being detained and are in custody, which is another kind of group that's gotten attention. People who are in custody in jails, prisons, and immigrant detention centers have become another kind of hotspot of the coronavirus. I know that professors Massey, Shah, and Lafaille have all done some work around kind of detention conditions, so I'm not sure which one of you is best equipped to jump in, but can we talk a little bit about the coronavirus in detention?
Well, it's very hard to get a handle on what's happening. We've heard about the people that are trapped in camps in Mexico who've been turned back from the border and denied their right to claim asylum in the United States. Many people get so frustrated with being in a camp in Mexico that they desperately cross the border and turn themselves into the Border Patrol once they've crossed so they can claim defensive asylum. and then they're shunted into an immigration detention system that was built to handle Mexican workers and process them quickly for voluntary departure, where they agree to be deported and just go back and try again. These people don't want to go back, so they don't take a voluntary departure order. They languish in detention centers. Two-thirds of the detention centers are privately owned, and reporters, health workers, nobody knows what's going on in them. We know that COVID is spreading rapidly and becoming endemic in these detention centers, but we really don't have any way of getting accurate information, and the Trump administration is blocking access to government-run detention centers, and the corporations won't allow people in the private ones. So it's really a black box, but a very dangerous one.
Dean Toyada, I was wondering if you could maybe talk some about what are the challenges facing, non-governmental humanitarian organizations that are trying to be responsive to these populations during the pandemic, and what are the effects of that going to be both now and, as the world tries to continue to recover from it?
Sure, but I first wanted to underscore something that Doug just said about data, which I think is a huge problem when we're trying to assess what the impact of the pandemic will be on refugees. It's hard enough. It's the data in developed countries is imperfect, and it's hard enough to collect data on infection rates and the degree of spread and so forth. But if you can imagine how much more difficult it is to monitor and to report back and to collect data on the impact of the pandemic and infection rates and so forth in migration camps and refugee camps, especially when host governments have absolutely no incentive to collect that data or make public the kind of devastation going on in these camps. These are, pretty invisible, I think, to a lot of people. And so NGOs are very important to the effort to try to mitigate some of these things, but they're up against a lot of challenges. And, chief among those challenges is the way that aid is, donors make their aid and how that aid is distributed and it's implemented. So aid can come from private donors, church groups or individual donors. Aid can come from governments, and governments, of course, are a huge, I think, donor to these kinds of efforts. And at least for the U.S., we have a very skeletal aid, I think, infrastructure, USAID, unless you count the military, which is an enormous bit of infrastructure for aid. But for this kind of humanitarian aid that we're talking about, you can imagine thousands of NGOs, non-governmental organizations set up to deal with these humanitarian crises. They may or may not have the expertise around something like dealing with pandemics or epidemics. A lot of these groups are so small that their capacity to be able to deal with these issues is very limited. And there's also very little cooperation or collaboration between these NGOs once they're on the ground and when they're trying to raise money from donor parties. So there are enormous challenges to mitigating the impact of this crisis through our existing infrastructure for humanitarian aid. So
I know I want to be able to kick it over to student questions in a bit, but I do think it's important to touch on the fact that at least, that the world continues to turn, and in the United States, we have a presidential election coming up that is going to implicate a large number of the policies that we've discussed, both the, migration policies and the US's role in the world and in international organizations more generally. I actually would love to hear from everybody, but maybe Professor Lafaille, starting with you on the what you're seeing as in terms of what the prospects of the presidential election would mean for the folks that you're dealing with, and whether you feel that their needs are being kind of adequately addressed in the campaign as it's shaping up.
And I think that we have to recognize that when we get out of this regime that we're currently under, we can't necessarily treat that like the normal transfer of power between two different administrations that we've experienced before. You know, we have to kind of treat it almost like truth and reconciliation, you know, like a country coming out of authoritarian government, you know, and recognizing that it has had 4 years of policy dictated by white supremacist exclusionary ideologies. And, you know, that requires not a piecemeal reversal, you know, a piecemeal chipping away at, you know, some of the policies that have been put in place, but a full-scale rejection of them. Now, with people in the migrant protection protocols and people in the camps and in the, you know, essentially tenements down in Mexico, you know, it's critical that we keep those people in our sights. Now, with our client, Floridalma, you know, we have been fortunate enough to represent her and a handful of others in a lawsuit where we won an injunction in May that allowed her to leave the camp to come to Massachusetts to be with her family. And you know, we've been able to do that for a small handful of clients, but there are tens of thousands of people, and this policy, you know, cannot be easily reversed. It really requires a commitment on our part to, you know, to do right by these asylum seekers that we have wronged.
Professor Massey, what do you see as kind of the stakes or choice being presented, given the kind of interplay of policies and demographic trends that you've been talking about?
Well, it's going to be critical for the migrants involved. They're suffering at very high rates, both those who are undocumented, under tremendous pressure from a massive deportation regime, detention regime, and those who are coming to claim asylum, who are locked up in detention centers rather than being treated in humanitarian ways, and the people that are languishing on the other side of the border. And one thing to bear in mind is that Trump policies for 4 years have really degraded our capacity to deal with these problems, particularly in the area of refugees. The refugee system, the system for integration and supporting refugees after they arrive in the United States, is almost all done by non-governmental organizations. And when they cut off the supply of refugees, it cuts off the funds to these organizations, and they have to lay off people, lose their leases on offices, and basically their whole capacity is degraded. And when the election happens, if it turns out that we end up with a different administration, you can't just rebuild those networks and those institutions overnight. It'll take time. And there are a lot of lives hanging in the balance at this point. So it's probably a hinge election for the United States in a lot of ways, moving from the most authoritarian and racist regime we've had in the United States in US history since the Civil War, and moving beyond it.
Although I know that we're going to, I'm sure that there will be more points that will come up as we transition to the student-led discussion. I'm going to turn it over to Arjun Singh, who is a producer for the show Boston Public Radio at WGBH News, and who has been collaborating with the on Forum Network events. So Arjun, turning it over to you.
Thank you very much, Darren. Thank you, everybody, for joining us today, and especially our speakers for being with us. Up next, we'll first hear from 4 Suffolk students who have questions of their own, and then we'll open it up to a question and answer period for the people in the audience. For everybody who's submitting questions, we may not be able to get to every single question during the actual event, but we do have professors who are working to answer them. So if you don't hear your question asked up here by me, hopefully you'll be able to get an answer soon. But while our students are getting ready, Adriana and Professor Shah, I think it would be great to start off. You spoke a little bit earlier to somewhat of the human impact of what these policies can do, but you guys work very closely and hands-on with immigrants who've experienced things particularly like detention. Adriana, can I start with you and ask, what is the psychological toll that takes on a person to be detained purely because of their immigration status? And how does that sort of spill over into the rest of their life, whether that be the way they interact with work, the way they interact with their family, or just re-entry into society? Adriana?
Yeah, detention takes a huge psychological toll. And one of the aspects of it that I know has been incredibly difficult for our clients is that they are surrounded by guards and people who have no idea what is going on. I mean, they often have no idea why they're in detention, how long they're going to be there, what their rights are. There's no right to an attorney in this system. And that constant uncertainty, they see people in their cell taken out in the middle of the night and deported. They just never know what's going to happen to them from one day to the next. And, it takes a very, very deep psychological toll on people.
Professor Shah, what has been your experience witnessing some of the impacts of these policies on the firsthand level?
Yeah, I would say the same as Adriana, and feel free to call me Ragini, by the way. My students and I have over the years represented a number of people in detention, and I think a lot of the same psychological effects that Adriana's referring to, we have clients who tell us that they haven't slept, who worry because the food that they have access to is, not food that either they're able to eat because, for example, they might be vegetarian, or that they feel like they can really eat in any sort of, the food in these detention facilities is horrendous, basically. They also sometimes don't have access to their medication, which can cause very long-lasting health effects. And they're worried also about the guards sometimes. I think it's fairly universal that the guards don't necessarily know what's going on. I think sometimes, unfortunately, that also rises to the level of guards using their position to be abusive. And so we have clients who have faced physical harm from their jailers and or psychological harm from their jailers. And so, it's a fairly torturous experience, even if it's for a short period of time. And the other thing I'll say is many of our clients, I would say most of our clients, have family members in the United States, and a lot of their family members are US citizens. And so the toll it takes on the family is also really quite dramatic. We've had kids who've had to start seeing therapists or drop out of school, people who have not been able to pay rent. And so detention, we could talk about what the rationale is for detaining people, but it certainly has some very negative impacts on folks.
Great, and I'll turn it over to our first student speaker, which is Crystal Toussaint. She's an incoming freshman who plans on majoring in psychology. Crystal, welcome.
Thank you. My question is for Dara Lind. In a recent article you had written, it was about prisons and coronavirus and kind of how prisons are not set up for social distancing. And my question for you was if you think the California model, where they released around 8,000 prisoners who were nonviolent and close to the end of their sentence, is the solution? And if so, what you think the downfalls of that were?
So one of the wonderful things about being a journalist is that I don't have to endorse solutions. I'm kind of prohibited from doing that, which is great because it means that I don't have to solve the problems that I'm pointing out. What I'll say is that what California did was a little bit late in the game, right? Because the state of California was one of the first states to get hit hard by the coronavirus. They took aggressive action in terms of issuing shelter-in-place orders, but didn't act as aggressively as some other states did to reduce their prison population. And so what you actually saw was that initially it looked like California had been doing a very good job of keeping it out of its prisons. And then recently, even after the toll in the rest of the state was kind of going down, there started to be particular facilities where it was becoming clear that there was a real coronavirus problem, which gets to the problem that I think a lot of facilities, whether they're state-run prisons or jails or federal immigration detention facilities, have had in dealing with coronavirus, which is you don't think of, you don't want to take up, these institutions have an interest in continuing to keep people in custody. They're not super incentivized to release a bunch of people in case something happens in the future. But once the coronavirus has been introduced into a facility, it is able to run rampant. And we've seen that absolutely in the context of immigration detention, where ICE was for weeks and weeks and weeks saying that it didn't have enough of a problem in its detention facilities to be, engaging in any mass releases. And then we started to see not only numbers growing substantially, but patterns that clearly were facilitated by ICE itself, moving people around from facility to facility. That's the kind of thing that you can only trace it after the virus has already started to spread through unchecked. But it's a question that I think a lot of institutions are going to have to deal with. And, it's a little bit easier in some way in the immigration context because so many people who are being detained by immigration are being detained as a matter of discretion. Like, the federal government could make the decision to release them if it chose. They're not serving a set criminal sentence. And as we continue to deal with the coronavirus and the possibility of, later waves of resurgence, whether we're going to see an equilibrium of actually we just have to keep fewer people and keep them further apart, it seems to be the only equilibrium alternative to we're just going to have this and it'll, go through facilities and we'll try to mop up after it as best we can and hope that nobody dies.
Fantastic. Thank you very much, Crystal. Our next student's questioner will be James Lee Jr. He's an incoming freshman who plans on majoring in law. James, welcome.
All right, this question is for Professor Massey. With increased homelessness in the United States, especially due to the economic fallout brought by the pandemic, public health systems face difficulties combating the COVID-19 virus with highly populated areas. In a state like California, where they have a high homeless population, what should be done to address the additional challenges of homelessness during the COVID-19 pandemic? Thank you.
Well, I'm not a public health specialist, but coronavirus is going to hit particularly hard any disadvantaged group, disadvantaged and excluded group, poor, segregated, pushed off to the side of American society. The homeless are extremely vulnerable. Undocumented immigrants are extremely vulnerable. Non-citizens are extremely vulnerable. Poor people, minorities, Black African Americans, of course, always among the most vulnerable populations. During the health emergency, the only thing we can do is to bring public health measures to try to mitigate the damage that's being caused by the virus and also to prevent the spread of the virus. And that, of course, requires public cooperation, which hasn't been happening in a lot of states. But the basic problems, the reason why these populations are so vulnerable is because we've disinvested in public health for so long and because we have such profound inequality in the United States, both economic and racial and social. And the bigger structural problems are the ones we'll need to solve in the longer term. Once the virus is gone, there'll still be vulnerable populations. But right now, we just need to focus on fighting the virus with social distancing, with masks, and with stay-at-home orders. And that's going to require, that really requires federal leadership from the top, which we just don't have at this point.
Thank you so much, James. Our next student will be Cassie Peloso. She's a transfer student who will be a junior over here. She's studying interior design. Cassie, welcome.
Hi, thank you so much for having me. My question is to any panelist, and it is: the United States has spent trillions of dollars in emergency assistance and aid relief to individuals, families, and businesses during the COVID-19 pandemic. How is it that the most vulnerable, including non-citizens who still file federal income tax returns, are considered ineligible for emergency assistance? What are steps either Congress or American citizens can take to bridge this gap to ensure support for all families across the U.S., regardless of their status?
Ragini, why don't we start off with you with that question?
Sure. I really appreciate the question. I would say that Congress could very easily extend unemployment insurance, or at least pandemic, what do they call it? Pandemic assistance, that new program that they had, to anybody without immigration status. That would be very easy for them to do. As you pointed out, Cassie, undocumented immigrants do pay particularly into the Social Security and Medicare tax funds. So many people who are retired now and on Medicare are benefiting from money that was put into the system by people who are undocumented. So that's one thing that Congress could do very easily. I think as citizens, that's something that we should be pushing our representatives and senators to do. If you're in Massachusetts, the Massachusetts delegation generally is supportive of extending these benefits, but nobody's really taken the lead. And this seems like a good time where somebody from Massachusetts, which is a fairly safe democratic state, could take the lead on issues like this. So putting it out there to all of the 170 participants, if everybody called their rep or their senator, then this could definitely be something that, that got done.
Great, thank you so much. And now let's open it up to the questions from the audience members. But Dean Toyada, I'd love to start this period with asking you a question, which is that during the primaries in particular, some Democratic candidates said that one of the problems or one of the solutions to dealing with an immigration and migrant crisis is to increase aid, particularly in Northern Triangle countries, and also increase our cooperation there. I want to know first, what are your thoughts on that statement? And do you think that we could stem the tide of immigration or influence it with a more active U.S. role in working in the Northern Triangle region?
I think that there was a time when that could have been possible. I think that moment has long passed, and the job is much more difficult now because the problems have become so embedded in the, they are basically failing states. And so you need to have a counterpart to work in many instances, and you do need to when you implement aid, whether they're projects or humanitarian, you need a counterpart and you need a partner, you need a host. You need people who can actually implement these projects on the ground. And it's really unclear that in failed states, when you don't have reliable counterparts, and for that matter, where you're not welcome, and we may not be welcome in many of these instances, either because we are in political opposition currently, or US policies in the past are the root of the problem. So, past policies to change regimes or to take sides in a particular local conflict, those are some of the reasons why we may not be welcome in those areas. So I hate to be a real pessimist about this, but I think it's really difficult at this point to see a quicker fix than there's no quick fix to this. This is something that does need to happen, within the countries that are where these conflicts are taking place. But a lot of these regimes are corrupt. They are creating the conditions that are causing these people to flee. And no amount of foreign aid, no amount of development assistance at this point, I think, is going to mitigate that problem.
Yeah, Dean Toyada, one of our audience members is a good follow-up to that. And before that, I wanted to thank all of the student speakers who asked a question today. Thank you for your participation. But Dean, can wealthy nations be incentivized to ensure global help to international organizations that they can get adequate funding? Is there a way to incentivize that even when their own nations are falling into economic peril?
Sure. I don't think people realize actually how little developed advanced industrial countries actually contribute in the form of foreign aid. I think if you ask, certainly $40 billion a year may seem like a large amount of money coming from the United States, but when you think about it in terms of our overall economy, that's like less than 0.2% of our GDP. So that's a minuscule amount of funding that the US provides in the form of official development assistance or humanitarian aid. The other thing, of course, is the way in which this aid has been dispersed, which has changed a lot over time. Doug had mentioned that we are almost completely dependent at this point on non-governmental organizations to disperse this humanitarian aid, and that's correct. And this is in large part because we've dismantled over time our official development assistance framework. And we have been, allocating more and more of our foreign aid for disbursement through the military, and in areas where there are, there's direct military engagement. So, this is a long term. This predates the Trump administration. It predates the Obama administration. There has been a long term shift in the way that aid has been disseminated and implemented. Is there a way to incentivize? Absolutely. I think there are better ways that we could be moving this aid. And I think there are ways that, we can make this, again, conditional on better policies in the host countries, in the countries that are receiving this aid.
Thank you. Adriana, let me turn to you with this next question. If Joe Biden were to win the November election, how easy would it be for his administration to reverse course on many of President Trump's immigration policies? And will that require more work with Congress, or is that something that he can do with executive orders?
Well, a lot of these, the damage done by the Trump administration has been done through executive orders, regulations, and they are things that can be undone following the proper administrative channels, of course, without the help of Congress. And it's going to be really critical that administration act to protect our asylum system, which has suffered hits from all sides in all manner of different policies designed to make asylum not only more difficult to get, but to make the lives of asylum seekers difficult and, frankly, unbearable. And it's really a question of political will and our desire as a people to honor, the best of our traditions, which, have not always, of course, the track record certainly hasn't been perfect, but our responsibility to those who seek help on our shores to play our part in this global system, and be a safe haven for migrants that seek our help.
Darren, I want to go to you with this next one, and then Douglas, great to get your voice in here too. But how do you think the current pandemic has exposed the problems of income inequality in vulnerable communities and segregation, particularly among the Latin American communities and immigrant populations? So Darren, in your reporting experience, have you seen the pandemic expose more of these inequities?
One of the things that's been very difficult logistically in the pandemic is that the very people who are the most epidemiologically vulnerable are the ones who it's hardest to get access to. Those of us who have been sheltering in place, who are trying to do the right things to protect ourselves and our loved ones, end up finding ourselves cut off from places and people who could be vulnerable to the disease and therefore kind of unable to reach out to them or help them. So there's a really vast extent to which we just don't know the harms that are being caused. We can see in the numbers that because Latinos in particular are more likely to be working in kind of frontline service industry jobs that are deemed essential worker jobs, that they have been more likely to get exposed, because they are more likely to be living in cramped living conditions. They're more likely to, infect their loved ones if they bring something home from work. we can see some patterns with that, but especially given that the nature of this coronavirus is something that appears to have long-term health effects that we don't fully understand, I think it's going to be a very long time before we really see what this has done to community health. The other thing that's really important to remember in the context of immigrant communities is right before this, the pandemic hit, the Trump administration implemented a regulation that strongly discouraged immigrants from seeking public assistance by making it a derogatory mark on their applications for permanent residence or green cards. And even though in practice that didn't do, it was mostly telling immigrants who already weren't eligible for things that they super weren't eligible, the chilling effect that that has had on US citizens, on green card holders, on refugees and asylees who weren't supposed to be covered by that regulation, but feel that any seeking of public assistance is going to jeopardize their futures in the US has been huge. And so even though the administration, tried to say, well, don't worry about getting tested for coronavirus, that won't count you as a public charge, there are so many, it's hard to get messages like that out there. And it's very easy for people to just say, anything I do that's going to interact with the healthcare system is going to put my future and my family's future at risk.
Doug, what about you? How do you think that this whole crisis has exposed the inequities, particularly among immigrant communities here in the United States?
Well, it's made them all blazingly obvious. If you just look at the mortality rates and the infection rates, it's completely apparent who's up and who's down in American society. I think the fundamental problem is a political one, and that is one of our two major parties has been transformed into a party of white nationalism and an authoritarian party. And it is pursuing policies that are not in the interests of the country and are benefiting small private sectors and catering to a reactionary base. And the Republican Party is not standing up to the president. In fact, it's supporting the president. And every time that he takes it a step further, they double down in their support. So it's really going to come down to this election. And if there's one thing that people can do to change this, the current political circumstances, is simply to vote for a Democrat. I don't care what Democrat. And if you think it's not a good enough Democrat, he wasn't Bernie, he wasn't somebody else, forget about it. We've got to end this administration right now, and it's going to matter in the election. And the Republicans, of course, are going to try to suppress the vote. So it's very important to mobilize politically, simply to get the Republicans out of power. It won't be enough just to get rid of Trump. You really have to bring down the Republican control of the Senate as well, or things are going to be very difficult to change. Executive orders only go so far. They can change every 4 years with a new president. And really, there hasn't been any major immigration legislation passed since 1990. So we need to have Congress in on it as well. And so it's really a political turning point and a political decision. And we professors have been told to be nonpartisan, but it's very difficult to be nonpartisan when one party is anti-science, anti-intellectual, and really promoting racist authoritarian policies.
Ragini, taking off that point, which is the lack of government policies that are really going out there to aid, particularly undocumented workers and immigrants, what are some of the resources that workers and immigrants have if they're not able to apply for government aid, if they're not able to qualify for even municipal programs? Is there places that they can turn? Are there organizations? Are there actions that are being taken? What have you seen and what do you think?
Well,
Absolutely. Oh, go ahead. Sorry, I didn't know.
The immigrants mostly take care of themselves and their families help them. And there are a lot of non-government organizations that are specialized in immigrant support, but they're under heavy fire right now, and they're basically in a defensive position and not able to provide the kinds of support that they might otherwise have been able to do.
Ragini, what were you about to say?
Sure. So just to add to that, I would say that there are two specific things that I would do if you're in Massachusetts. One is there's a fund called the Mass Undocu Fund, which has been set up by a number of labor organizations, really that's collecting money and then dispersing it to people who are undocumented. I've been privileged enough to be doing intake for them for the past 6 weeks. And I've talked to, dozens of people who have lost their jobs in industries like the restaurant industry and beauty salons. And, a lot of the industries that really had to close completely because of this pandemic are completely populated with immigrant workers, and particularly undocumented immigrant workers. So if you're so inclined, there's a link to Mass UndocuFund in the chat for folks. The other thing I would say is that there's also mutual aid funds, and I don't know to what extent this is happening around the country, but in Massachusetts, basically every city has a mutual aid fund. And I think this is something that it makes me feel very hopeful about democracy, because I think it's sort of small democracy. And it's a lot of people coming out to support their neighbors, buy groceries for people, do errands for people, whatever. But it also has created a really interesting political space where people are doing things like mutual aid societies are doing things like solidarity statements with Black Lives Matter, or solidarity statements with undocumented workers. And the last thing I'll say is, in addition to undocumented immigrants being very vulnerable, we also depend on them, right? Because all of our food really comes from their labor, their harvest. More than half of the farm workers in this country do not have any immigration status. And so that is who is putting the food in the grocery stores. The same is true for poultry and other meat processing. I mean, all of that labor is done by people, not all, but much of that labor is done by people without status. And so I think we should sort of reframe how we think about immigrant labor in this country as something that's not just something that we need to support from a humanitarian perspective, but it's sort of like survival. If we're going to survive as a society, we need to be lifting these people up.
Sticking with that idea, Ragini, is that a recent Supreme Court decision said underage minors need to be released from detention. But what does that do to families? I mean, who will take in these children, and what are the decisions families are making right now, knowing that separation is a very real and difficult thing, and that we could experience a point where parents are sitting inside a detention center while children are being released? What have you seen families and their decision-making process be like right now?
Yeah, and I'm sure Adriana and Doug have things to add to this as well, but I would say that there definitely are families who are deciding not to migrate because of the fear of being separated once they reach the border. Now that's in a situation where they're not fleeing, a situation that's just very dangerous, but where families are fleeing situations that are dangerous, they're not, I think for a lot of people, right, if you think about yourself and when you might have been in a situation where you had to make a decision and you knew that it might put you at risk, but the other risk that you knew about was much greater, you might go ahead and take that risk. And I think a lot of people sort of come to the US border hoping that they're going to be the one family or the one of 10 families that actually makes it through the system okay. And so you still do see a lot of people, coming to the border seeking to enter the United States. And while that order is helpful for children, it is not necessarily helpful for families, and it's not helpful for adults. And in reality, what we really need to do in the United States is roll back this system of detention, which started fairly recently in the late 1990s. So, it will take a lot to roll it back because there's been a lot of infrastructure built in to detaining immigrants, but we could do it. There was a time when we didn't detain everybody who came into the country or everybody who broke an immigration law. In fact, there was a time when we didn't really detain hardly anybody. And that system had to be built so it can be unbuilt.
The one thing I would add is that because of everything that the administration has put into place since 2018, whether that's the MPP program, now with the CDC expulsion order, so few people are even getting to the point of being detained for a long time. And there's been something of a disconnect between how much attention the American public is willing to give to people when they're in US government custody, as opposed to when the US government is just kind of is shipping them back to Mexico, back to their home countries summarily, just kind of telling them you don't have to go home, but you can't stay here. And I think that any sort of long-term kind of, if we're going to turn around from the current trajectory of US policy, it's going to require a very sustained attention, not just to what happens when somebody is in government custody, but also to the risks or opportunities that face them if, thanks to a government policy, they end up somewhere different from where they started. And that needs to be seen as the consequence of our policies too.
Great. Well, we don't have a lot of time, but we've covered a lot of territory today. And I wanted to know if each of you could share, one closing thought for all of our students that you think they should leave this conversation with. So Dara, while we're talking to you, would you care to start us off?
I mean, I think that thinking about kind of those who are outside government custody is, I think, a very important thing. I think the other thing is that we're talking about a lot of the effects on immigrants in the United States, both like public health, as we were saying earlier, and just the psychological and educational effects of living in fear of everything that's been happening, or feeling like their own Americanness is being questioned, is something that we're not going to really understand the full impacts of for a long time. And now that we've seen, now that America as a country is having explicit conversations about the long-term effects of racial discrimination and inequality, thinking about the ways in which the things that are happening right now are going to perpetuate that in the future is going to be an important part of that.
Great. Adriana, how about you?
I think the critical thing here is for people not to be silent, because, mere silence here is what allows a lot of these policies to be carried forward. It's the out of sight, out of mind. This massive humanitarian crisis that we've needlessly provoked at our border. These people, thousands of people that we needlessly detain because we're able to, forget about them once they're inside a facility. And I think, if there's one thing that I want people who are listening to this to do, it's to keep alive the stories and the fight for people who are in custody, who are outside the United States through these terrible and unlawful government policies, and to make sure that we can do justice by those people, and that we can again seek to become a country that is able to abide by basic humanitarian commitments to people who are seeking our help.
Great. Doug, how about you?
Well, the system that we've got now was really built in the post-1970 period, and we built up a mass incarceration system. We built up a system of economic inequality. We created an immigration detention system, a massive deportation regime. These were all made by decisions. And we can unmake those decisions. This is all very recent, and we can undo this. And we should not give up hope. And we should exercise our political power to the extent that we can, to its fullest, to change the regime, to change the administration, to put in a new set of policies that will move the United States in a much more egalitarian and non-racist direction.
Ragini, closing thought?
Yeah, I think I really agree with what everyone else has said. And I think what I would add to that is that, hopefully there will be a change in the administration. And I would love for everybody on this webinar to keep the stories and the thoughts about what is necessary to ensure a healthy society, which includes immigrants, in mind, even if there is a Democratic administration, because it's not like the Democrats have been great on immigration. They're great compared to Trump, but they're not that great. And they have done a lot of damage. And we really need to hold their feet to the fire in the same way that we are trying to hold the Trump administration's feet to the fire, if that happens, and I hope it does.
And Dean Toyada, you have a closing thought for our students?
Yes, that these policies matter, and you don't have to respond from a place of altruism or idealism, that even just from the perspective of cold, hard national interest, that alone is a reason to respond with good policies, humane policies, and to tackle these issues of conflict and refugees and immigrants into this country. There is the concept of blowback, and it's going to come. We will experience blowback from the current policies, and we have experienced that blowback in the past for failed policies. So, you know, I don't want everyone to leave thinking that we're only doing this out of the goodness of our heart. There are some really good national security interests for pursuing good policies in these areas.
Great. Well, thank you so much to all of our panelists that joined us today. Thank you to the students who came on camera and asked their questions, and everybody in the audience who asked really fantastic and gripping questions. I'll turn it over to Professor Coolidge now, but thank you for welcoming me as part of your class.
I want to to add my chorus of thanks to Arjuns and thank all of our panelists who I think brought out a theme that has been really strong in these 6 weeks, which is that the initial assumption that COVID-19 was the great equalizer or the small d democratic disease that was impacting everyone equally is clearly a fallacy. And we heard that really strongly today from the perspective of really fragile communities. I'd like to invite everyone to join us next week as we examine the impact of partisanship, particularly in the United States, and the pandemic. So it's a panel we call Common Enemy, Disjoint Response. And we look forward to seeing you all here next week at 4 o'clock. Thank you.